Welcome back to the MediBytes channel, everyone. As a healthcare professional, I know firsthand that pregnancy is a journey filled with so many beautiful, unforgettable moments. But it can also bring about some completely unexpected and, quite frankly, scary physical changes. Today, we're bringing you a dedicated explainer on a very rare pregnancy complication called Pemphigoid Gestationis. And when I say rare, I mean it only affects about 1 in every 50,000 pregnancies. So if you or a loved one are dealing with some strange, intensely itchy symptoms and you're desperately searching for answers, well, you are in exactly the right place. We're going to dive into the medical data together to get you some much-needed clarity and peace of mind.
Here is our quick roadmap for today's explainer. 1. What is Pemphigoid Gestationis? 2. Recognizing the symptoms. 3. Is the baby safe? 4. Understanding high-risk pregnancies. And 5. Diagnosis and treatment.
All right, let's jump right into section 1. What exactly is Pemphigoid Gestationis? At its core, this condition is a relatively rare, intensely itchy rash that pops up either during pregnancy or right after delivery. But why does it happen? Well, the medical consensus points straight to an autoimmune reaction. Think of it kind of like having confused antibodies. So, normally, your immune system acts like a shield, right? It protects you from outside invaders. But in an autoimmune reaction, these abnormal antibodies get their wires crossed and mistakenly start attacking the body's own healthy tissues. And in this specific case, that reaction shows up right on the skin. Now, when a severe, blistering rash suddenly appears all over the body, it is completely natural for panic to set in. One of the most common anxiety-inducing questions expectant mothers have is assuming they've caught some kind of dangerous infection. So let's tackle this misconception head-on.
As our clinical sources state directly, and I quote, "The condition is not an infection, although it could look like one." This is an absolutely crucial point for your peace of mind. It is not contagious. You literally cannot spread it to your partner, your kids, or anyone else. Despite its intense and honestly sometimes alarming appearance, it is strictly an internal autoimmune response.
Moving right along to section 2, recognizing the symptoms.
So how does this actually play out? The timeline of Pemphigoid Gestationis is actually pretty specific. It usually kicks into gear during the 2nd or 3rd trimester. It often starts off as flat or raised red spots right around the abdomen, specifically circling the belly button. Over time, these spots evolve into fluid-filled blisters, which can be small, large, or totally irregular in shape. And here's the really frustrating part. The rash actually tends to worsen immediately after delivery. I know, not what you want to hear. But the good news is that it does naturally disappear within a few weeks or months postpartum.
Now, it's kind of fascinating to see how this rash maps itself out on the body. While it starts at the navel, it certainly doesn't stay there. It can spread like wildfire across the trunk, down the arms and legs, and can even show up on the palms of the hands and the soles of the feet. But there is a silver lining here. The face and the inside of the mouth are usually completely spared. And for doctors, knowing that specific detail is a huge help in differentiating it from other skin conditions.
But here's the catch. Because this condition is so deeply wired into the body's internal systems and hormonal fluctuations, it's really important to know that it can return. It very often reappears in subsequent pregnancies. But even outside of pregnancy, certain hormonal shifts, like getting your period, ovulating, or even starting oral contraceptives, can actually trigger those symptoms to pop back up later in life.
Okay, on to section 3, addressing the biggest question of all. Is the baby safe?
We completely understand that absolutely none of those physical symptoms compare to the emotional weight of worrying about your child. The baby's safety is just the absolute #1 concern for any expecting parent facing a complication like this. But the crucial takeaway here is a pretty striking contrast. Mom is going through the ringer, dealing with an intensely itchy, painful, blistering rash. But the baby? The comforting reality is that the baby is usually completely unaffected. Every now and then, a baby might be born with a similar, very mild rash, but that actually disappears entirely on its own within a few weeks. The intense autoimmune battle happening on the mother's skin simply does not translate to the baby's skin in the same severe way.
That being said, we definitely need to be straight with you about the clinical risks. While the baby's skin is safe, the condition does slightly increase the risk for a couple of specific complications. Doctors are going to want to monitor the pregnancy super closely for premature birth, as well as a condition called intrauterine growth restriction, which really just means they'll be tracking the baby's size to make sure they are growing exactly as expected inside the womb. This is exactly why having expert medical supervision is so vital.
And that leads us perfectly into section 4, understanding high-risk pregnancies.
Listen, hearing the words high risk can be terrifying, but in the medical world, it's honestly just a classification. It just means the mother and baby need specialized, expert care. A pregnancy can become high risk for a whole host of reasons. It could be physical characteristics like age, issues during past pregnancies, or pre-existing things like chronic high blood pressure. It also covers conditions that develop entirely during the pregnancy, like gestational diabetes, preeclampsia, or in our case today, Pemphigoid Gestationis. Bottom line, it just means your medical team is going to be paying extra close attention to you, giving you the VIP treatment.
Finally, Section 5, Diagnosis and Treatment Options.
If you're currently suffering from this unbearable itch, the diagnostic process is actually super straightforward, so no need to panic. Step 1 is just a simple visual evaluation. Because the rash looks so distinct, doctors can usually diagnose it right on the spot based on its appearance. Then, Step 2, if they need absolute 100% confirmation, they'll do a skin biopsy. They just take a tiny little sample from the affected area and test it specifically for those confused abnormal antibodies we talked about earlier.
Once you have a diagnosis, there are very clear, actionable treatments ready to go to manage the flare-up safely. For localized relief, doctors often prescribe a corticosteroid cream, like triamcinolone, that you apply directly to the skin to calm the itch. Now, if the rash is severe and spread all over, they might step it up to an oral corticosteroid, like prednisone, to really tackle that inflammation from the inside out. And finally, non-drowsy oral antihistamines can be a huge help in relieving that intense itching systemically, which is absolutely crucial so the mother can finally get some much-needed rest.
So, what does this all mean for you? Well, knowledge truly is your best defense. When unique complications like Pemphigoid Gestationis pop up, actually understanding the science behind your symptoms is a game changer. It allows you to take charge of your care, ask the right questions, and partner effectively with your high-risk obstetricians to ensure the absolute best outcome for both you and your baby.
As we wrap up today's explainer, I want to leave you with a quick thought. How will you use this knowledge to advocate for yourself and your baby during your healthcare journey? If this explainer helped empower you to take charge of your maternal care, please like, share, and subscribe to the MediByte channel. We are completely dedicated to bringing you these vital, reliable healthcare explainers so you never have to navigate your medical journey in the dark. Stay healthy, stay informed, and we will see you in the next explainer.